Chapter 4 Available Treatment Programs. Most smokers have the drive of the kick, the stick at one time and another. Some of the successful, many more fail. Have the failure rate. It could be some of the treatment that's not available to just extent enough is available to stop smoking. Programs haven't been treating with the entire program, only part of it. Hypnosis. Some smokers try to quit. Hypnosis deal with channeling something in your subconscious state. But hypnosis demands a high level of motivation as well as effort. The missing of the method of treatment is social support following up. In other words, nobody helps with get through cigarettes while craving the cigarette, not even upon the hypnosis. If you try the method, make sure that it's done only in a licensed psychiatrist, psychologist, and social worker that has been accredited with the American Social Council Social Work hypotenuse theory treatment. Acupuncture is a relatively new treatment in the Western world. Chinese have utilized acupuncture for thousands of years to relieve pains, ailments. Some success with the treatment calls the sticking needles and nerve points of the body. Basic idea: reroute the message traveling those of the nerves. Can be argued acupuncture may have relative relieving actual physical addiction to cigarette, but there's now no known studies to show that acupuncture stops smoking habit. It doesn't treat the psychological addiction, so you have to add counseling and support program to become acupuncture most effective. Nicotine gum is something that has been on the market a number of years, only available for the prescription gum. Contains nicotine, is designed to reduce withdrawal symptoms, allow smokers to lessen his or her dependence needing to nicotine. Chewing the nicotine gum alone won't help you to quit cigarettes. You'll need to get addiction help with a support group. Hard electrical shock. You could get extreme, get into rapid smoking electrical shock program. You inhale smoke every 6 seconds until you get sick of the stomach and rapid smoke program. Condition program. Basic idea with the associated nausea with the act of smoking. There are studies showing that very effective for certain, but not everyone's cup of tea with electrical shock therapy. Juice and electrical current every time light up. It's supposed to create an aversion to help behavior, not the nicotine. As you have to ask yourself, if they're really worth it. Group programs. Group programs are any way with the help to stop smoking. The only treat with the program, so with the psychological, physiological portion, do nothing physiological addiction, nicotine. Self-help. In the 1980s, we known that dedicated self-help that you could buy books, audio tapes, visit video cassettes, occur with you just about any ailment. The jury's still out whether they really did the job. All the program treatments mentioned above the work. Hypnosis, they require the constant motivation, something a lot of people lack. What's more, each of the program treatments address the addiction addicts aspects of the smoking, with the habit aspects of none of the treatment, the whole problem. Nicotine patch has making news late. It's even another method that may prove the most effective, but for its most effective type of treatment, it has been used with the human support system. How nicotine patch works: attached to any part of the skin, doesn't have hair on it. Have any hair on it. Most people attach to the upper arm. Others use the either side of the upper chest. The patch contains certain drug nicotine. This is absorbed through the skin with the tiny blood vessels near the skinny surface of the object of the patch to provide body constant flow of the nicotine craving the cigarette eventually gone. Treatment depends on the type of the patch, with the response and physician recommendation. Normally, most people to wear a patch for about 6 weeks, with a maximum of timing of 3 months. The use of the patch 3 months longer may lead to low level of nicotine addiction with any prescription drug. Some of the risk of patch may not be an answer for you. A physician can talk with you. One thing about with the patch, smoking is well wearing absolute forbidden. You could be affected by an overdose nicotine. Some of the most common prescription patches with Nicoderm, Prostep, Habitrol, the nicotine control. Do it yourself. And then there is I Can Do It Myself program that take enormous willpower with you unequivocally say I won't work. Think about it at this moment and not really doing it yourself. Some of the other action causing it to pursue with a method. For example, your spouse has to, if you don't quit smoking, she's leaving you. You stand and lose your job if you keep smoking. Your physician constantly telling you to break your smoking habit. Can't smoke in many social settings. The point is, all of these many other situations contain another element I can do myself with the program. I truly may feel better after I do it without the cigarette. However, the following days won't be kind. You need strong support to help you stick to your program, becoming a non-smoker. Chapter 5, Goal-Oriented Treatment Program.